Hey, Tim, how are you?
Good. How are you?
Doing well, thanks. Happy Monday.
Same to you, Aaron. Thank you.
Sorry, I'm 2 minutes late here. I was actually in the wrong Zoom room. I have one that's called podcast recording and then one that's like a nutrition one. And I honestly, I'm just not good at staying consistent with both of them. So,
No, it's so funny you say that. I just happened to notice I'm waiting, and it says waiting for your a nutrition consultation, and I thought, oh, good. I can get some help while I'm on this call.
it's a win-win, right?
Exactly. So thank you, and I appreciate you doing it free of charge too.
Yeah,
So
no, anytime, anytime.
thank
It's so great to
you.
connect with you. Thanks so much for coming on.
Yeah, yeah. Thanks for having me.
Yeah, my pleasure. It's so funny. I find random stuff online through like webinars and stuff like that, and I just deep dive, and I'm always looking for I hate to say it, but like less flashy, like influencer type stuff and more of like I guess the word is just wisdom, right? People that have been doing this for a while and can provide more evidence-based information. So yeah, I'm really excited for our chat today and excited for you to share about MetaMe.
Thank you. Thank you. Yeah, it's funny. I was just talking to somebody, another entrepreneur earlier this morning. And she's a patient and suffers from IBS. And we were just talking about for lack of a better word, the amount of junk that's out there, that might look good. And to your point, might be flashy, and not that all the flashy, influencers are wrong or have bad information. But sometimes you're like, oh my gosh, that's horrible.
Yeah. And these are, and again, we're talking about a population of people who are, really hurting and really desperate for resolve. So I'm
Yeah.
excited for our conversation today. And I'm just really excited about this avenue of, using, gut-directed hypnotherapy, for example, as a treatment, because, patients are really struggling with alternative options that aren't, invasive or very restrictive. So, yeah, I'm excited. I think it's a refreshing, kind of topic to talk about and one that is evidence-based.
Absolutely. Yeah.
Excellent.
Agree with all of that.
So, if it's okay with you, I'll just get started. Would love to hear a little bit more about you and, kind of what kind of got you interested in this whole I guess well so MetaMe is your company, right? And
Correct.
I'd love to hear kind of what the inspiration was for you to get into this field.
Yeah. By way of background, Aaron, I'm actually a 30-year pharmaceutical veteran. So I've spent a career helping develop and sell drugs to treat multiple conditions. About half of the drugs in the therapeutic areas that I've been involved in were in gastrointestinal conditions, going all the way back to early 2000, when I first got involved in the area of GERD, or gastroesophageal reflux disease. But then in 2004, irritable bowel syndrome, and in 2008, inflammatory bowel disease. And I really have enjoyed working in the space. Um, but then along about 2018, I met the actual founder of MetaMe Health, Danny Bernstein. And Danny is a patient. Danny has suffered from irritable bowel syndrome and inflammatory bowel disease his whole life, and it's been treated at Northwestern University by some of the best physicians in those respective areas. And it's there that he learned about the use of behavioral treatment for functional GI conditions like irritable bowel syndrome, and specifically gut-directed hypnotherapy. But he's not been in the space in terms of the healthcare ecosystem. He had an idea, but didn't really know what to do with it. And when we met, I said, Danny, your idea is brilliant. This entire patient population, as you had mentioned earlier, Aaron, suffers, even though they're being treated with multiple drug therapies. And there's a place for this in the healthcare system. And if we can develop a piece of software that makes it easier for patients to access this type of therapy, I think patients, physicians, payers, everybody are going to be, interested in it. And that was 2018 when we started, and here we are today.
Wow, that's incredible. So quite the history you have in all different types of GI conditions. Would love to hear if you have any, I don't know, like big takeaways about anything that was very successful for you in the pharmaceutical industry that you noticed.
You know what I definitely learned, particularly with this patient population, is they really and that's probably not untrue in many populations, but they really do look toward their physicians. And what we learned was how long of a journey it took these patients, to work through the healthcare system, and how frustrating it was for them to finally find a physician to properly diagnose them. And when they did, that relationship, that bond is very, very important. So although as pharmaceutical manufacturers, we had the ability legally to promote to patients, direct to consumer advertising, things like that, but that does not work unless the physician really understands the product population, the product that you're talking about, the appropriate patient for it to be used in, and that relationship between those two. You can't underestimate the power of that relationship.
Sure, absolutely. And I mean, not to brag about dietitians, but I will, right? Is that, we are part of that puzzle. And when you find a good physician who's going to say, hey, you've got digestive issues, or we could take it even further and say you've got, chronic pain or this or that, the power of diet and taking a holistic approach to anyone's treatment can be very important. So I think the dietary side, we're kind of really making way where people are starting to know there is a connection to pretty much any sort of chronic disease, that diet is a tool for them. What I think is maybe less discussed, but becoming more popular, at least in, the population that I'm treating, is this idea that mental health is another powerful full tool. And to be quite honest, in my practice, I see it to be a major part of the root cause for a lot of functional gastrointestinal disorders.
Yeah, absolutely. In fact, there have been multiple articles recently published in the medical literature speaking to your point about really integrated care, meaning it's not just the physician seeing the patient and prescribing a drug or any therapy, but the physician working in tandem with the nutritionist, with the mental health provider, with the social provider, everybody working as a team, an integrated team, to really understand the patient situation and deliver the best therapy. And so many times, you're right, nutrition is at the core of it. There is no doubt about that.
Yeah, excellent. So let's dive into the discussion of the gut-brain connection, just kind of understanding for the listeners how stress impacts the gut and vice versa. And, I can speak to some research in here as well.
Yeah, it's funny when I speak about GI conditions and irritable bowel syndrome, and describe it as its core defect is this disconnect in the brain gut axis. It generally gets an eyebrow raised. Like, well, wait a minute, it's a GI issue. There's something wrong with the gut. No, not at all. In total, it's this disconnect between the central nervous system and the enteric nervous system in the lining of the gut that aren't communicating well together, right? And typically in this case, you've got a hypervigilant enteric nervous system that sends signals to the brain that for normal digestion, for example, would be amplified, and then the CNS takes that signal and can't really down regulate that signal, and then you get these cascading reactions in the body that cause the problems that come along with irritable bowel syndrome. So it's really is this brain gut connection. And analogy I try to use sometimes to help people understand it is your watch. If you're wearing a watch today, you can be assured that your epithelial cells, your skin cells, and your hair on your arm are sending signals to your brain saying, hey, something's on you. You need to be careful and watch out for what's on your wrist there. But your brain has figured out already in context that it's just a watch. Forget it. So much so that you don't even recognize you're wearing a watch anymore. That's what normal digestion would be like, in terms of the enteric nervous system, the gut sending a signal saying, "Ooh, I feel a bump. I feel something moving through my colon." But your brain understands the signal and says, "Don't even worry about it." And so you don't feel your digestion. IBS patients, that gets broken. And they're constantly feeling that watch on their arm, and it's actually causing them pain. That's what's going on in IBS, in this brain gut disconnect.
Sure. And I love the way you described the watch situation. And I also love how you mentioned that there is something physically going on in the body, because I think a lot of the times people will think, oh, my doctor's just saying it's all in my head. But they're not saying it's all in your head. They're saying that your head and your gut are connected. There's a very big difference between those two statements. And, I think that's a really important distinction.
It absolutely is, there. We hear that when we talk to patients all the time, this concept of it being all in your head. And that really was, physicians were saying that, especially 10 or 15 years ago. I'd like to think, we've all evolved, medicine has evolved, and now we have this higher understanding that it's not all in your head, without a doubt. There is something at that disconnect between the two systems that aren't speaking well to each other.
Sure. And you also mentioned this interplay between there's an immune component to it, right? We have that gut associated lymphatic tissue. So if somebody has, say pathogens in their gut or dysbiosis, or they have food sensitivities that they're consuming a lot of these foods, there is a component there that those foods or that immune dysregulation can be sending those signals to the brain as a communication. But that's a survival mechanism, right? That's a notification, the same way as your smartphone is notifying you, your body's letting you know something's going on, and best not to be ignored.
Yeah, absolutely. Yeah, and there's so much yet to be learned with what you're talking about there, and exactly we know that's occurring, but we don't know what can we do about it in every case. But yeah, absolutely, that is all true.
Yeah. Now let's talk a little bit about IBS, how it's diagnosed. I know you've developed several drugs for IBS, so I'd love to learn about, these drugs that you've helped develop and kind of the mechanism of action, and maybe we can then understand how this gut-directed hypnotherapy, for example, is a promising, inclusion in someone's treatment plan.
Yeah, so from a diagnostic standpoint, and let me disclaim, I'm not a physician, right? So others might be able to explain this even better. But there's Rome 4 classification that have been developed that spell out certain criteria that need to be met. Now, with IBS in particular, as we've kind of already discussed, there are no specific biomarkers. There's no one lab test that can be made and taken to confirm diagnosis. This really is a process of understanding the symptoms you've been incurring, pain with some form of bowel dysfunction as well over an extended period of time, on a routine basis. And when that occurs and there are no other reasons for that to have occurred, or causing those symptoms, then a formal diagnosis of IBS is made.
Yeah. So when somebody looks up the diagnosis, they're like, this seems super vague. You've got bloating and gas. It's like, yeah, I've got all those symptoms. And so it's hard to make that distinction, but they do have that Rome criteria that is more specific and allows the physician to make that proper diagnosis. I work with a lot of patients who have, small intestinal bacterial overgrowth, for example, and that's a population where, I'm sure you've, heard a lot about this, but, a third of patients who have SIBO are often misdiagnosed with IBS, for example. So it's tough to make that diagnostic, decision, because there's a lot of overlap between that broad list of symptoms and other conditions. And it's not easy as a physician to just go in there and start testing for everything, and getting into even hormone balance and mental health. I'm sure that's very challenging.
Yeah, and I think the takeaway from a patient perspective, and we stress this in the conversations that we have, is that because these symptoms of IBS can look like other symptoms of other conditions, whether it's SIBO or IBD or other things as well, it's really important that the patient continue talking to their physician, find a physician to get the proper diagnosis, and don't just try things. I mean, depending on how serious it is, right? Don't just try things at home. Really get the diagnosis so that you can get the right therapy, whether it's nutritional assistance and a diet, or whether it's a prescription drug or an over-the-counter drug. But make sure you're using the right therapy to match to the problem that you really do have.
Mm-hmm. So I didn't mention this yet, but I also struggled with really awful digestive issues my entire life. So you talk about visceral hypersensitivity. I mean, I even now still, like, I live in leggings, right? I've got this nervous system that is hyper active, and I've done a lot of, work on managing that and getting myself to a place where my life is much better. But throughout that journey, I would say the biggest change that I saw was when I started keeping track of my symptoms and noting when things would get worse and when things would get better. And I hated doing it. I hated tracking. I hated the idea of tracking and having to do something every day that felt monotonous. But I'll tell you, it then allowed me to make certain trends and be honest with myself, and then bring that to my physician, my gastroenterologist, and say, listen, these are the symptoms I'm having. I've done some research, but I'm not the expert in X, Y, and Z. So, that's when I made the biggest, headway in my progression of healing. So I would recommend that to anybody, is to do that tracking or that journaling, so that you can start to maybe pull in some of those connections and not leave out things like sleep and hormone changes and mental health. And food is important, but it's not everything. We forget about, my father passed away 6 months ago, or there was a big event at work that was very stressful. Those things are absolutely correlated to these symptoms. So I think that that's a really valuable tool to have that is free.
Yeah, yeah, absolutely. It is free, outside of how difficult it is, right? Yeah, you have to put the work in, but agree completely. The more information you can have to understand your situation, the more helpful it's going to be for your healthcare provider to help you work through it all and understand what seems to be triggers. And don't leave anything out. You're right. The work scenario, that those events in our lives that we might not even really understand are stressful, really do cause stress on the body. And that stress on the body can affect a lot of different things, from sleep to GI problems.
Mm-hmm. Yeah, you brought up
Absolutely.
a good point about, the idea of stress and what that looks like. I even think of a recent time when my boyfriend and we went to go eat with a new couple that we'd never met, from our church. And we sat down, and I wasn't really hungry. I didn't really want to eat because I was trying to converse with these people, and I was excited, and it was, kind of nervous because you're trying to make a good impression. And so all of those things, and even though it was a positive experience,
Positive event. Yeah.
positive event, it still was, my nervous system was still alert, and it did impact my digestive system. So yeah, not just negative, not just stressful events or things like that. It could just be excitement or control, or whatever it may be.
Right. Absolutely.
Excellent. So let's talk a little bit about, well, actually, let's talk a lot about gut-directed hypnotherapy. First, what is it? What is gut-directed hypnotherapy?
Yeah, so gut direct, if you boil it down to its simplest, right? So gut directed hypnotherapy is really an intervention or a technique that encourages focused attention and a deep state of relaxation for a patient, which then really allows the mind to be more receptive to some therapeutic messaging. And it's these suggestions that really do help the hypervigilance that we've been talking about, and allows the reinterpretation of those signals that are coming up to the brain, and allows the brain to understand this is normal. So it really is a way of just taking the conscious world away for a short period of time, and allowing that brain to kind of understand, again, to use the analogy, the stimulation that is coming from the wrist from my watch is normal. So don't overreact, if you would. And that's what directed hypnotherapy is. And the data to date is usually, or the process, I should say, is to deliver a therapeutic, 7 therapeutic messages, or 7 therapeutic sessions for over the course of 7 to 12 weeks for gut-directed hypnotherapy. And each of those sessions typically are about 30 minutes in length.
Okay. And is this something that you would do in an office of a practitioner? Is it specific to just using an app? Like, what are the parameters there?
Yeah, to date, and if you look back at the data and the literature, gut-directed hypnotherapy has been shown effective since 1984. So what are we talking? 30, almost 40 years now, we've known that this therapeutic approach can treat patients with IBS and help all their symptoms, by the way. It helps not only the pain and the bloating, but it affects the nausea, the constipation, the diarrhea, both, if you happen to have both. It actually has also been shown to have an impact on potential anxiety, depression symptoms that can sometimes come along with patients with IBS. So it's really an amazing opportunity for patients, but it's currently only available from trained gastropsychologists, right? Where can you get this? Well, there's only about 200, 150 or 200 trained gastropsychologists across the United States, most of which are located at key teaching institutions. So if you were to go to a major university like Northwestern University here in Chicago, or Stanford or Harvard or UCLA, those GI departments all have gastropsychologists on staff in the integrated care, along with nutritionists, where they really treat holistically the entire patient population. But there are 30 million people who suffer from IBS and 200 therapists. That's about 150,000 patients per therapist. It just can't work out. And as a result, as you can imagine, there's about a 6 to 12 month wait list to get in to see those practitioners to try to get this course of therapy. So it's not often used because there are very few trained therapists. And that's the whole idea behind MetaMe Health, and why we started the company, to see if we could increase the accessibility of this type of a treatment to patients.
That's incredible. Yeah, I do want to dive into the app and how that works. I would love to point out the research part that you brought up in terms of the use of this gut-directed hypnotherapy and the reduction in these IBS type symptoms. Specifically, one of the research studies that I think it was done by Monash, or it was in the American Journal of Gastroenterology, where they basically they looked at the effectiveness of gut-directed hypnotherapy versus the low FODMAP diet, and they found that it was actually up to 72% effective in reduction of these IBS type symptoms. That's huge. 72% is huge.
It is huge. I think, if you go all the way back to 1984, when the first study was done out of Manchester University, there may be 16 other randomized controlled trials, one of which that you mentioned, and they all are showing typically 60 to 70% patient impact, a positive, clinically meaningful impact on their symptoms. It doesn't eliminate all symptoms, right? But you're really having a significant reduction in the symptoms that you're experiencing. Yeah.
Yeah, that's amazing. So let's talk about MetaMe, and how do you take that physician-led experience into an app, and what does that look like for walk a listener through it in terms of what they can expect, and should they use it the same way that it's that, you said about 30-minute session, or what you said, where it's 7 to 12 weeks?
Yeah. Let me walk you through that and how we even were able to take what they're doing in a clinic setting and put it into a digital therapeutic. So about 1994, there was Dr. Oliver Paulson out of University of North Carolina who actually continued studying the use of gut-directed hypnotherapy in the treatment of IBS. And what he did was he actually scripted out the therapeutic messages that should be delivered to patients with IBS so that he could test them to see if they really did work on a routine basis. And sure enough, over time, he proved that to be the case. So we partnered with Dr. Paulson to take his script, and this is called the North Carolina Protocol. The North Carolina Protocol is what many of the gastropsychologists that I mentioned at Northwestern or UCLA, they're all using. And so they're using the messages that Dr. Paulson had created. We took those messages and built it into our digital therapeutic. And what that now allows is the delivery of the gut-directed hypnotherapy via a video audio recording. So much like a Zoom meeting or a telehealth session with a practitioner, except it's pre-recorded. So that you can take each of these 7 therapy sessions over the course of the 12 weeks when you need it. There are some limitations and requirements based on the FDA approval, but still, whether you wanted to have your therapy session at 3 in the afternoon or 3 in the morning, it's available to you, and you don't have to leave your home. You can and travel in to see your therapist. You can just do it right here at the comfort of your home.
That's incredible. So what does that look like after that, 12-week mark per se? Like when they go through those sessions, I mean, you said these are scripted messages. So after that, is this something that you can just continue to revisit, or are these scripts that you then are supposed to kind of adopt on your own and create more of like a meditation type of environment? Like, what does that look like for continuation?
Yeah, there's a couple of ways to think about it. So interestingly, very positively from a patient perspective, the data around gut-directed hypnotherapy shows that after you've taken the 7 therapy sessions and you're all done with it, the positive effect that you experience can last up to 5 years. That's the longest study that I'm aware of.
Wow.
There are multiple studies looking at 1 year after therapy, coming back to patients and saying, let's assess your IBS symptoms. And you're still seeing 50, 60, 70% of the patients having positive relief from their IBS symptoms. So you basically saying you don't need to do what maybe you were suggesting to do to continue to use the program. And in fact, in our clinical study, which we ran, we tested that same thing. After the 12 weeks of therapy, we had no interaction with the patients at all in the study, went back to them at 6 and 12 months, reassessed their symptoms. Sure enough, 55% of the patients were still experiencing a positive benefit from having taken the gut-directed hypnotherapy session a year ago. So there really is no need. Now, should you want to, or should you need to, if you had a stressor in your life that the symptoms relapsed and they kind of came back, you can just get another prescription from your physician and take a whole nother course of therapy again.
Wow. Now, so this is, you need a prescription from a physician for this. Okay. Okay. And then when you do this, the question that I'm curious about is the mechanism of action, because I'm a science person. So I'm like, okay, so is it this idea of you're basically retraining? Are we working on like vagus nerve, vagal tone? Are we just kind of like, again, it seemed like that exposure and just making that connection of this is normal type of thing? Like what's actually going on that's creating this long lasting effect? And then my second question, hopefully it's not too much, but was there any other intervention involved with that hypnotherapy, or was it just the hypnotherapy alone that created that long lasting change?
Yeah, your first one is much more difficult to answer.
I figured.
And the truth is, we don't know. I mean, this is a part of science that we are continuing to try to study and understand. There are some theories that the gut-directed hypnotherapy is acting on both systems. It's helping the enteric nervous system and that hypervigilance kind of calm down. At the same time, there's some evidence through functional MRI studies that show there is a change in the brain, in the way the brain reacts to signals of pain from the gut after a course of gut-directed hypnotherapy. So we know something is happening in both areas, but exactly what's driving the ultimate positive effect is still one of those science unknowns, and not uncommon in terms of therapies, drug therapies in particular. We know it works. We're not exactly sure exactly how or why it's working, but we know it's working.
Well, it's funny funny that you say that. You keep going. Sorry, I'll not interrupt you.
Oh, no, that's okay, because I actually forgot the second part of the question.
Okay, so I will comment on that then, because it's funny that you said that, because even now, like, you know, we've had SSRIs in the market for years, right? But now we're understanding more about the mechanism of action. And oh, it might not actually be because of increasing serotonin. It might actually be related to, you know, I forget the exact study. I posted it on LinkedIn a few months ago, but that's very interesting. And, you know, I'm curious, but that doesn't mean that I would disregard a treatment that works, right? So that's the most important thing with any client. I always say, you know, with any lab result that they have, well, this is abnormal. Well, do you have any symptoms? No. Well, you know, your quality of life is top priority here, and symptoms are, you know, typically what we'd be addressing versus, you know, specific, you know, lab value. Obviously, there's nuances to that, but
Right.
So the second question was, what was the second question? The second question, now it's just escaping me. Let's see. First question was the mechanism of action. Second question was, oh my goodness, my brain.
No, mine as well.
Don't you wish you could rewind and just go back to it?
No.
Oh, yes. The second question was there any other intervention in addition to the hypnotherapy that could have led to the outcome of those results? Or did they just use gut-directed hypnotherapy?
Yeah, great question. Yes. And it's the simple answer. It literally was just gut-directed hypnotherapy. You know, in our study in particular, we had a 362 patient study. Just under 20%, about 18% of the subjects that came in, the patients that came in, were on drug therapy for the treatment of their IBS, but they were still suffering, right? So this was added on to it. The other 80% were coming in not on drug therapy, did not add drug therapy, just had the gut-directed hypnotherapy.
Wow. Okay. Very cool.
Yeah.
So I guess my only disappointment is that you need a prescription to get this from your doctor. I want this to be accessible to everyone. Do you see a day when that is possible?
Yeah. You know, I don't know. That would be up to the FDA, I guess, right? But I think there are two important things to think about, and I think good reasons why a therapy like this is a prescription-based product. The first relates to what we talked about a little bit earlier, that the symptoms of IBS can mimic other, believe it or not, more serious conditions. And delaying treatment for those more serious conditions is in itself dangerous to the patient. So to have therapeutic programs like this that have been proven and claimed to treat the disease, it's important from the FDA's perspective to protect patients and ensure that it's used by the right patient at the right time. So I think that alone is very important and good enough reason, if you would, to ensure that this is controlled from a regulatory perspective. The other one is gut-directed hypnotherapy, or any hypnotherapy itself. There are patient populations where it should not be used. Patients with dissociative disorder or significant PTSD, or even serious depression, particularly suicidal ideation along with their depression. those patients should not go on to a course of hypnotherapy without first getting the underlying mental health under control with a professional. Those really need to be taken care of. And again, if this is just out in the public domain, there's where you now could even start to cause harm in those particular patients.
That makes a lot of sense. Yeah, I see how that's really protecting the patient there, and that's a beautiful and very important thing.
Mm-hmm.
So I'm very excited about this. I think it's great that it's accessible to patients, assuming they do have insurance and a physician who will prescribe this if they're appropriate candidates for it. Now, if you don't have a doctor who even knows about it, like, could you bring this to your gastroenterologist and say, "Hey, I, heard about this. Do you think I'd be a good candidate?" Is that a good way to approach it with your doctor?
It's absolutely a great way, Aaron. And in fact, we're just in the process of beginning our commercialization efforts and preparing all those types of materials. But we've done along the way, we talked to a significant number of physicians and gastroenterologists. They understand what gut-directed hypnotherapy is. They understand those 16 randomized controlled trials. What they don't have is access to recommend you to go see anyone. And so even if they don't know about Regulora, the brand new prescription digital therapeutic that can be used, as soon as they see it and take a look at it, they immediately get it. And they say, "Oh my gosh, I can now provide you this therapy that I know works and allow you to take it at home with really risk-free," right? No drug interactions, no long-term side effects, anything like that, or no short-term side effects for that matter either. The typical response is, "I'd absolutely prescribe this to my patients." So I think if patients took the information to their physician, they would probably have a very positive response, and easily get a prescription written.
Mm-hmm.
And you mentioned the insurance standpoint, whether you have insurance or no insurance, it takes a while for insurance companies to catch up to new therapies like this and to add it to their formularies and to reimburse for it. We understand that. I've been through that for the past 30 years when we bring out drugs to the market. We've actually got a program in place that we charge no more than $75 for the full course of therapy for patients. So if they were to get it, again, whether they have insurance or no insurance, they're going to pay no more than $75 for all 12 weeks of therapy.
Which, when I'm in just regular therapy, have been most of my life. It's just $150 per session minimum.
Exactly. Yeah. For 7 therapy sessions of this, if you were to see a therapist, you're probably going to pay somewhere north of $750, maybe $1,200 easy for it.
Mm-hmm.
We're making it available just for $75 out of pocket right now.
That's great. Yeah, so it's affordable. The biggest thing would be, the patient does have to take that responsibility and commit to it, which I do believe, if you've got IBS and you've got these symptoms, you are trying to do anything you can. So I can't imagine compliance would be an issue, in terms of, I don't know if you've seen any issues with
No, we
compliance.
do. I'm actually glad you mentioned it. And I think about how you described your tracking of symptoms for weeks and months and how difficult it was, and it is hard. It is we're all patients, right? Of something. And taking therapy can sometimes be hard. We've made this as simple as we can. And we sometimes refer to it as it's the easy button therapy. And it's really no more complicated than watching a Netflix movie. If you've ever sat down and pushed the play button, that is all you have to do here.
Sure.
Set aside 30 minutes every other week for 12 weeks to press a play button, sit back and essentially be relaxed for the next week of your life. That is all you have to do. And in fact, we have seen 90% adherence to therapy. So in our study and in the real world, patients using the product today, 90% of the therapy sessions are being taken.
Amazing. The thing that I would would make a distinction about between the, idea of this tracking and this app that is the gut-directed hypnotherapy is this concept of belief, right? The belief that it's going to help. I think that would be the only barrier I would foresee, is someone saying, this isn't going to help me. I'm not going to do this. Whereas like the tracking for me, I was like, is this really going to be the answer, right? You've done so many different things. So that's why I have you here today too, is to present the research and the success that you've had with this practice, and to know that it dates all the way back to the 1980s, you said?
84,
Yeah.
1980s.
So there you go. I mean, there's do we know the exact mechanism? No, but also keep in mind we don't necessarily know the exact mechanism for SSRIs, which are life-saving, antidepressant medications that have been on the market for way longer than this hypnotherapy has. So just a message to the listener to, be encouraged by that, and, see this as an opportunity to try something that could really work.
Yeah, your belief in the concept of belief is spot on. And whether you relate that to the use of a gut-directed hypnotherapy app like Regulora, or honestly even just a drug, it's been shown study after study that not only your belief, but believe it or not, it's actually been shown your physician's belief in the therapy they are prescribing to you can influence the effectiveness of that therapy, which is crazy hard to really comprehend, but it's been shown multiple times to have an impact.
I believe without
I do
finding a better
too.
way to say that. Yeah. I mean,
Right.
it's that encouragement, that team, right? You need to feel supported in any sort of journey that you're going on in the health realm, and just having that, expert who's going to be there and say, let's give this a try. I think this is really going to work for you. If they're going to sit there, if you're starting a startup, right? And the CEO says to you, I don't think this is going to work, but let's give it a try. Like, you're not going to go into that excited, or whatever. You have to have that mentality going into it, not a mentality of like everything's going to be perfect and zero symptoms ever, but just this is going to help me in some way, and
A
maybe I don't see it
realistic
right now.
opportunity. Yeah.
Yes,
Yep.
absolutely. Well, so great. I really appreciate you sharing all this information with us. I'm very excited about, is it Regulara? Is that how you pronounce it?
Regular. Correct. Yep.
Regulora. Yeah. So really great. I'm going to start, definitely speaking to my clients about this a lot more, and having them bring this to their physicians as a tool that they can use. And hopefully people will share this with others.
Awesome. We would love that. We're here, and Dan, like I said, Danny's a patient, right? And I've been in this space, and in fact, I think it is about half of the team members here at MetaMe Health are patients, of IBS in particular. And we want to make this as accessible as possible to treat as many of the patients, appropriate patients, across the US that are continue to suffer from IBS. So yeah, please help us share the word.
I absolutely will. So, Tim, the most important question of the episode is, what is your favorite childhood memory with food?
That's a tough question. People who know me, Aaron, know that I don't have a memory.
Oh, that's probably
uh,
the best response I've heard yet, actually.
I have an absolute horrid memory. And now if you're going to make me struggle to even tie it to food as a child, I can't even come up with anything. It is so beyond me.
A holiday, a
It is
dessert.
it's a really, really great question. So the only thing that does come to mind is, like many people, maybe, on your birthday, you got to choose what the family had to eat. I would always choose spaghetti, and still to this day, it is spaghetti as my birthday meal.
I love that. Well, my 30th birthday is actually coming up in 2 weeks. So I don't know that spaghetti would be on the top of my list. I'm a big taco person, but I can see why spaghetti would never go out of style, because, it'll never be something that I don't like personally.
Exactly. I love it.
That's great. Well, I'm
What
glad that you
a
shared that with us. All right, Tim. Well, it was so great having you on today. I really appreciate you taking the time, and I'll be sure to link all the information about, MetaMe in the show notes if anybody wants to check it out.
that we greatly appreciate it. Love being here. Thanks, Aaron.
All right. Have a great rest of your day, Tim.
All right, you too.
Bye-bye.